and welcome back to the Private Practice Growth Club YouTube channel. I have another featured practice owner, but not just because of a private practice, but also because of her other projects very similar to what I do at Private Practice Growth Club and in the audiology space. So welcome, Vera, and thank you so much for joining me today.
Hi, Tazeen. Thank you so much for having me in the Private Practice Growth Club. I think this is such an important platform that a lot more health professionals need to be invested in, not just under the banner of private practice, but looking at growing healthcare entrepreneurship as a solution to the many challenges we're facing in our climate, at least in South Africa today.
And so I think it would be, I prefer my guests to introduce themselves rather than me reading off a whole long bio, because you do have quite a long bio. So can you please tell everybody who you are and a little bit about your private practice?
Thanks. I think, I must pick what I can share that is useful in the bio, because in the end I can understand, and I'll take that as positive feedback to shorten my bio. My name is Vera-Genevey Hlaysi. I'm an audiologist by profession, by practice, and day-to-day living. I do training and research at the University of Cape Town. I do some business and private practice, as do most other people, through a private practice in the Northwest called Concierge Audiology, where we offer home-based convenience services at the doorstep of clients. And then lastly, and most recently in the last year and a half, I am the co-founder and head of audiology at Assisa Hearing Solutions, an audiology equipment supply and distribution company.
So let's go back to, this all started where you first became an audiologist, right? So let's start there and go back there. What prompted you to become an audiologist?
More often than not, Tazeen, my story is actually quite similar to most others. And I still see it today in academia with how people end up in audiology. I didn't know that an audiologist is a thing, that it's a profession, that it's something that I'd come to love. I grew up with the options of doctor, accountant, lawyer, the usuals, especially you grew up in township areas where you have to get A's and you get a bursary and you're going to become a doctor. So a doctor was one of the options that I had. I got early conditional acceptance. I don't know if they still do it now. And at that time, it was for grade 11 or standard 9. And, I assumed that meant that was fine. But fast forward to when you get to the University of Cape Town, that's where I did my undergraduate training. You come with a couple of, A's and you think, oh, you were it, in your small village, you are the number one. And you get to UCT and people come with 7 A's. And I remember that was my first almost real experience with like a little bit of like, this is not a level playing field. How do you have 7 A's? We had 6 subjects, when you realize that you were even competing on the same playing field. So then UCT at that time had over-accepted students for the medicine program. And unfortunately, this is still common practice where they over-accept, and then it's a battle of who has the better marks or is the better fit for what program. And at that time, because I had a bursary, they accepted me for any of the other health science programs with the promise that, look, the first semester is similar in healthcare. You're all doing anatomy, you're doing, physics and chemistry, you're doing the basics. And so you'll decide halfway through the semester if you want to migrate. And that's how I came across audiology. It was the thing that I didn't know about on the list. I knew physio, I knew OT, I knew speech, and then there was this one odd one out. And I think that was my first experience. Now in retrospect, where I can say curiosity got the best of me in the most positive way. I was like, I don't know this. Let me spend 6 months on it and then I'll come back to medicine. And I've never gone back. Halfway through the semester, I'd gone to the Dean's Merit list. I was always that kid. And even till the end of the year, like, okay, now you can come in. And I said, no, I think I'm going to stay. And I've made that decision every year since. I'm now in the audiology profession. This is probably year 12 or year 13 as an audiologist, and I love it so much.
That's amazing, because even my previous interview with Greenhow Occupational Therapy, it was exactly the same story, and the similarities was that she came from a rural, Pietermaritzburg farming area. Yeah. So the same thing, she didn't know that occupational therapy even existed and wanted to be a doctor. So it's so funny how your path takes you down a different route. But the key is you actually had to have taken a path in order to get
Yeah.
there. I mean, like you had to just like, well, I didn't get into medicine. Now I'm just not gonna,
Yeah.
into
Yeah.
health sciences. You would never have gotten
Yeah.
here. So tell me,
Yeah.
what was it about audiology that then made you fall in love with the profession once you started studying it?
I think it was a merit of circumstances. I think the first obviously is being given an opportunity or being given a platform where you have to prove yourself. I thrived off of that pressure. And when I got into health sciences, audiology seemed like the little black sheep of the family. Any and all allied or rehab professions, I'm sure will relate to this, because you're either in medicine or you're the other. So we already fell into the other, and I related with that personally as an African young woman coming into an institution like UCT, the socioeconomic and political context of all of that. I relate with being the other, with being the underdog. So I think just rehab in and of its own, or allied sciences, I could relate, number one. But number two, I think I felt completely in place with the personalities of the people that were doing training in audiology. It felt like you were really impacting lives. Not that any other professions doesn't, but it rang true to me, because it also came with the novelty of I did not know that hearing loss, balance issues, communication issues was such a big thing. It was the big obliviousness that I've lived with, and maybe ignorance, part ignorance in terms of lack of awareness. It's like, oh my God, can you imagine how we can take this to, where I'm from? If I've never heard of it, and I'm the one random person that made it out. I'm from Limpopo, Indiana, a small rural town further up north in South Africa. And so for me, the potential, the possibility, I completely lashed onto that. And then thirdly, I think being in a smaller program, in most rehab professions, compared to the medicine program where it's hundreds of people, in rehab, you're often a small community of 15, 30, 45, 50. And in fact, if you're a class of 100, which often is like physio, others, you're like the big class, I fell in love with the community and just the smallness of, we are in this together, and it's us against the world, and we're gonna do it, and so that entire ethos, and I think that still rings true even today, where we still feel like we're the small stepchild in the health professions, and it's us against the world. But I think the promise of having an impact spoke to my altruistic nature, the underdog nature of just how rehab functions with the rest of health sciences. But I think it was a highly technical profession. And I'm sure, as you can tell, and as your audience can tell, I love talking. I do well with talking. I do well with presenting. It's a skill that I've always had from young, but I never knew where to place it. And I'd always done debating and done other things. But smack bang in audiology, all you do is talk, all you do is educate, all you do is communicate. And in fact, you help others communicate. So it fell with my personality, with my background. It resonated with some of my values. And as they say, the rest is history.
Yeah. So tell me, like when you are, when you were a student and you found your passion in what you want to do, but it's like you said, it's the technical skill, the knowledge, the experience, but that's only the thing that you do, right? But now you still have to go and work in that profession. As a student, if you compare what your perspectives were, or what you assumed what working as an audiologist would be like once you graduate, versus what the reality was, in all the years leading up to this point. Was there a stark difference? And what were some of the biggest things that, like you'd like students to kind of current students to be aware of?
Look, I think, first of all, we cannot ignore the reality that the entire system of education, at least for the most part, or for the majority of South Africans, whatever creed, tribe, race you're from, it comes with the promise of a better socioeconomic structure. You get educated so you can come home and you do better. You help your mom, or you help your siblings, or you become the success story. So there's that pressure. So the major expectation that I had coming into any health profession, because at that time I wanted to be a doctor. I didn't even have an idea really about what kind of doctor, it was just a pathway, because what led up to me even choosing that profession is the promise of just being better. And also we have to acknowledge the social standing of health professionals in normal general communities is that you become the helper, the better person, and not even in a bad way, but you become the person that people can look up to. And so definitely that was my perspective, that I was going to, graduate and be the helping person, be the person that has the opportunity to help my family. So there's a socioeconomic standpoint of, you expect you're going to earn, in your mind as a student, I'm going to be a millionaire, I'm going to build my mom a house, I'm going to buy a car, and all of that stuff. It's a dreaming mindset. That's the first thing. Then secondly, you are trained at the best of the best. I mean, University of Cape Town is the best university in Africa for certain things, and other people who are from Wits and Stellenbosch and UKZN and other universities will come at us. But I think as it still stands, it's the best academic institution in Africa, primarily based on, its social, historic and geographic context. It still is the best in some aspects, at least with infrastructure. And in healthcare, I came into the health sciences faculty in the era of the late Professor Bongani Mayosi, and the entire ethos around what we were doing then was we were the best, we are excelling, and we're doing it for the community, we're doing it for other Africans. We're going to leave Cape Town and we're going to go replicate this in Mkungundlovu, in Ventersdorp, in Groblersdal, in Guyana. So we came out of that institution believing, because I think of the greatness of people like Professor Mayosi, they're so great and inspiring you to be like, you can do it, and rightfully so. So I came out with this completely savior mindset that I'm just going to go into the book and I'm going to change the mindset. But what I didn't anticipate was the fact that real life public healthcare institutions are not teaching academic institutions in the middle of the Western Cape, in the middle of Cape Town. The resource, the infrastructure, the systems, everything that comes with creating a healthcare system, it doesn't necessarily look the same. And so outside of your own profession, you are then thrown into this whirlwind of contextual factors like, oh, there isn't even a big hospital. You're in a clinic and you're like, what do you mean? Where's the Groote Schuur? Where's the Chris Hani Baragwanath? Or whatever the big hospital equivalent is that you got trained in? Or where's the Charlotte Maxeke for the Vertsies? But like, you then realize, oh, not everything just functions because you walk in and everything is there. You then have to then start a role that you learned about as a, by the way, you have to be an advocate for your profession. Then that becomes a major thing that you do. You're an advocate to clinical managers, to provincial staff, and sometimes you're even attending political meetings to talk about how are we going to, advocate for more budgets to be given to allied, right? Then you realize that when you were being taught those seminars in public healthcare, that is the reality. It wasn't just the case study. The reality is primary healthcare in South Africa is still just starting. And I think we also got trained in the era where HIV and TB and cancer was still the big thing. Now I'm sure it's COVID and mental health and other issues as it evolves every decade. But back then, we thought we had HIV, on the lock. You have to educate some people. But then the bigger thing that was coming up as the big chronic thing was diabetes. And it was like, oh my God, what is this, So very, very big differences, resource-wise, structure-wise, systems-wise. And I think looking back now, we didn't get nearly enough training on that. How do you function in the system? How do you function at community level? How do you function when there's nothing? What we're showing here is the best. This is what you work your whole profession towards. This is not what you're going to get at community service level. And then, of course, came my first retrenchment in a couple of years when government couldn't absorb, I think is the word that they still use. They couldn't absorb my post. And then you're like, but what do you mean we don't have a job? I thought we're a scarce skill. We're here to help the community. And government says, no, we can only even keep so many doctors. And then you're like, but like, what about the rest of us? What about the nurses? What about the OTs? What about the physios? What about the optometrists, the dentists? By the time you get to speech therapy and audiology, because we're also still an adjunct to speech, it's just like you feel like, oh, I'm back where I started again. I'm still the underdog. So major differences, and it was quite startling. But I think with time, you learn how to find your own place. And I'm sure with that big, long-winded answer, you can see how I ended up in business, how I ended up being, I feel right now, an advocate for healthcare entrepreneurship, and seeing how you can be part of the solution. Yes, government has many issues, and we're now at the cusp of NHI and the elections, and there's many other things happening in the healthcare economy and sector, but we can't all keep waiting for that government post. It's just not possible. It's not viable. It's not feasible. What then do we do? How do you then still provide services to those that need? And at a community level, and hopefully at a reasonable price where everybody can still afford, because we cannot escape from private practice and affordability, that constant juxtaposition.
Yeah, no, absolutely. So on that note about starting a private practice, tell us about when you started your practice. When did you start your practice, and what was that like when you'd made that decision?
Yeah. I registered my company, funny enough, at the first sort of threats of employment, literally a year after my ComServe. But I didn't know what to do with it. And just starting a company felt like like a big mountain that I climbed. And back then I used to do just like CPD training courses, because that's what came naturally to me. I'm a speaker, I'm a trainer, I'm an educator, and these are things that I learned with time to know how to hone as a skill. So the actual company, I registered it a long time ago. And then only now when the world shut down for COVID 2020, I started thinking, maybe I can actually use my company and repurpose it, re-register it, do all the legal things to make it into a private practice. Because, again, issues about what is my future in audiology? Will I keep my job? What will happen after COVID? So the same kind of fears existed. Obviously, I'm in a different space professionally now and with much more experience, and I know the industry much better, but the same fears and anxiety still existed on, will I have this employment post-COVID? Should I be doing something for myself? And so I started it 2020. And at that time, we didn't fall as an essential service. And to me, that felt very ludicrous, because we are in communication. And the big thing that COVID did was it isolated people from each other. And then we saw the rise of mental health issues. And I'm not saying one caused the other, but I'm saying we can't ignore the correlation. We are a social species. The fact that we're able to communicate and share thoughts and share ideas and have a relationship with other human beings is what separates us from plants and mammals and other things on planet Earth. And for the fact that that wasn't an essential service in COVID, again, it felt, you'll catch the theme here, again, we're at the back of the burner. Unless a person is bleeding, unless a person needs an oxygen machine, they're not going to entertain anything else. And in turn, and even till today, we're still facing people and even children whose language hasn't developed appropriately, because we spend so much time with our faces covered. And part of language development is observation and spontaneous learning. But there wasn't spontaneous learning for a lot of kids because they weren't communicating, they weren't playing. And I think all across rehab, we all use play as a tool and as a learning platform. And communication was majorly hindered by the one big thing where there was a mask across our faces. And so we are still unbundling. So for me, that entire time felt like now more than ever, we need more people that are going to be going to people's houses, giving language stimulation, that are going to be going to old age homes, repairing hearing aids. Because if your hearing aid died in COVID, you wouldn't be allowed into a hospital because communication wasn't looked as an essential service. And so for me, that in my mind felt like the right time to start a practice and take that risk and offer at-home services for people. And that's how my private practice, Concierge Audiology, was born.
So what I'm hearing is that one of the differentiators of you started your practice at the outset as a home-based practice, mobile practice.
Yes.
So talk to me a little bit about that, because I would imagine that is the exception rather than, that's more of an exception. That's not what's currently being done. So talk to me about that.
So I think the environment and the circumstances really, made it more of a norm, because if you think about it, we got everything from our phone. I was also a new mom then, and I thought about what are the things that I am using now, right? You could get everything on your phone, from your groceries to, getting a plumber to come help you with something, or, everything was based on your phone. And in my mind, I thought, how could I use the phone to offer a service with what I'm good at? And I thought, imagine someone could book me and I could come to their house. And obviously after that, I had to figure out logistics about like social distancing and all the rest of it. But the idea was born from, so what happens if this thing is indefinite? And I think now looking back, it seems a bit crazy, but I know we all thought that's how the new world is going to be. We're never going to leave our houses. The world is never going to be the same. We're all going to die. And I thought, but people aren't going to be able to communicate with one another. They're just going to sit in their lonesome. And so in my mind, it came from that. I didn't think, oh, how is a private practice run? No, I thought, what are the challenges that are being presented now in the society that we live in? And how can I be part of a solution? And I think that's how, to me, it became a norm. But also, I think the other thing that was a big challenge, and I'm sure most people can relate to, the startup costs of a physical brick and mortar practice are almost insurmountable. And anyone who's ever started a private practice starts in a huge amount of debt. And so I looked at it and I was like, but like, telehealth is a thing that was being pushed in COVID. Let me read up a little bit more. And I think my researcher brain again got curious and thought, how can I use telehealth? How can I use mobile and mobility and the flexibility of technology to offer basic services? And that's where I started, because I thought to myself, if you think about it, when you go see a doctor, what is in the doctor's room? It's a table and a chair. And I thought, people have tables and chairs in their households. And I thought, okay, what do I need as an audiologist? I need an otoscope to look in someone's ear. Then that's the first equipment I bought. Also, it was the least expensive, and I bought an otoscope. So to literally take it one step at a time. And before I knew it, in a couple of months, I was so booked. I was so busy. It became a thing. I started having a language for it. And then, of course, I had to figure out a billing structure. How do you bill? How do you not? What do you do? How do you keep patient files? And then you realize, look, you can do everything digitally. You can, it became a step by step, but this is just one way to say, I didn't think about, I want to start a practice in a fancy medical center. No, I thought about, how can I participate and be part of the solution in the current circumstances? And when you look at that, the build up to what the solution looks like is based on the circumstances, not based on what is the tradition and what is the norm. And that's how I built it from there. And it had many challenges, because for a lot of people it was like, yeah, but like, where are you gonna send like official letters? I was like, to my physical address, and with each question, with each hurdle, you have to figure it out. You have to ask a few people in the industry, because there are some practitioners that do home visits, but that's not the norm, that's the exception. So you're like, okay, so how do you do the home visits part of your thing? Let me start there. And that's how it grew from strength to strength.
So I think one of the things that's very important that you're talking about there, which is what I've come across across all the professions, is a big mistake that a lot of people do when they start a practice, is that, yes, it's good to have like this long-term vision, but they almost like want to have everything at the end point now already. So, I mean, like from an OT point of view, as an OT, I can just speak from our profession, and I'm sure it's the same with physio as well. There's always this, let's say you want to start a pediatric practice, then it's like, I'm going to get every standardized assessment, which all comes from the UK or the US. So I'm spending like 11,000 Rand on one assessment. And then I want all the equipment, the play equipment, everything that I need, like upfront, when I don't even have a single patient yet. And then now you have this upfront cost, whereas what you're saying is that it's first identify what the need is. Then as you try and solve the problem and be part of the solution, as things come up that you identify you need, then get that thing. So if you come across a client that now needs X, Y, and Z, and you need that specific assessment or piece of equipment, now look at, okay, is this worth me getting this? Am I going to get more of these kinds of patients? Do I need to refer this person? Okay, it's worth me investing in a piece of equipment. And now I'm going to solve that problem. And then the next problem comes along, and the next problem. So you almost have to, the long-term vision is more the direction you're going. It doesn't dictate what you need to do in the present moment.
It's not the starting point, no.
Yeah, exactly.
And I think, Sorry,
Yeah.
just to make a comment on that, I think that also just highlights that in healthcare practice across the professions, we're not given the basics of how to monetize our skills, how to create a business out of our skills, because we have a multitude of skills that we are trained under the premise that you're going to work under an employment contract,
Yeah.
right? And that
Yeah.
and that completely builds this expectation that wherever I work, even if it's for myself and in my own business, it must look like the rooms that I was trained in, because that's the norm that we think, OT or physio or audiology or speech therapy looks like. You think you must have a room, you must have a booth, you must have all the standard assets, but you forget, even for an academic institution where you're trained, or the practice that you see across, in the other town, it took years to get there. But should we be given just the bare basics? And oh, okay, this is how you start. Because if you look at any business, you have to pilot, you have to do a feasibility. Does this work? Is this an income generating idea or not, before you put in capital? But it took me so long to learn that. It took me a lot of mistakes to learn that. And like I said, I started business a long time ago, but by the time I had the confidence and the courage to start a private practice, luckily I'd learned along the way some of the pitfalls of, you don't have to have it perfect from the get-go. Because I know a lot of people spend a lot of money on things like, I need to have a perfect website, I need to have a banner, I need to have scrubs, I need to have this. And before you know it, you're sitting in so much debt. And that just takes away the passion for what you do, when you have a big minus that you're working towards. Whereas, if you think about stimulation therapy, whether it's for speech audiology or any kind of rehab, all you need is, you already know it. You can use whatever exists in the child's home. It's authentic, it's real. You don't need extra equipment. And yes, it's nice to have, testing materials from the other side of the equator. But really, if you think about it, most of them you have to adapt. They're not practical. But if you use what mom told you, if you use what grandma told you, what the teacher tells you, what already is in the classroom, you can write a service level agreement with a primary school, and they give you a small room, or they give you a classroom, and you start with classroom therapy. Or, but because we are so ingrained with, this is what it's supposed to look like, we want to start at what it should look like versus what can I do right now in my capacity. So I think that's a valid point that you're raising.
But also, I think one of the other things you mentioned now is about not being taught about how to monetize our skills. And one of the problems or the discrepancies I see again between, the pedestal we put doctors on versus the other, like you call us, is that I'm sure no doctor has been told you didn't enter this profession to make money. That the discussion never even comes up. Because with being a doctor already comes this like status symbol, right?
Yes,
but all of us, or I'm sure all of us, like when we
Yes.
as allies, we are told the same as teachers are told, you didn't become a teacher to be rich. You didn't become an OT to make money.
Yes.
But why is it even necessary to say those things? Like, why is it even
That's
necessary to plant that seed in someone's mind that might not be the reason you became, but why are you even saying it? Because by saying it, you are implying that it's wrong for you to want to make a
Yes.
living and be
Yes.
generate wealth and
Yes.
be and it's not only about I want to be able to support my family. There is nothing wrong if you want to generate wealth, if you want to
Yes.
break the
Yes.
generational the generational cycle of poverty in
Yes.
your family. There's nothing wrong
Yes.
if you want to create generational wealth. And we
Yeah.
say that, as soon as we say that, we cut people off. It's like, you can't think about wanting to be profitable and like make money out in
Yeah.
this industry.
Yeah.
You must be the savior.
Yeah. No, we vilify monetization in healthcare. I don't know if it's as rife in the doctor side of things as it is in rehab or in online, but it is severely vilified. I don't know whether it's a language that we as a collective have just adopted from, I don't know from where, but we've adopted this language where your main role is to help and to service others. And, for most of us, it taps onto our altruistic side of our personalities, and we relate, of course, I'm here to help. But I think what we definitely need to start working on and changing mindset is that there is an economy in healthcare, in all sectors of healthcare. There is an economy in OT, there's an economy in audiology, there's an economy in speech therapy, there's an economy everywhere. and you choose to participate as a contributor or a passive recipient of what the economy deals to you in whatever sector of life you work in every profession. And I think the more we start looking at it like that, the more we'll start unlocking some of the barriers. Because, for example, you mentioned you buy some tests overseas for 11,000 Rand. Now imagine a young OT who starts and is working in a particular area and figures out a particular way to test and approaches a university, gets it piloted and tested, and has another person in the university partner with them to validate for our region. Then that's a resource that you own, because in any case, any and every resource you think of in healthcare is linked to someone's name. Right? You can create one for yourself, Tasneem, if you were encouraged to, if you were given the resources to, if you were enabled to. Then we could be buying it from you, and you are creating an economy of buying and selling test materials among health professionals and rehab professionals. But that thought doesn't even spark our minds. Instead, what sparks our minds is we will spend 10 years of research critiquing why assessments from the other side of the equator don't work.
Yeah.
If we spend an equal amount of time and expertise looking at what could work for ourselves, how can we create that for ourselves? In 10 years, we can have a multitude of resources that we can buy and sell from each other. And that is just one example of an economy in healthcare. There's also the economy of renting space, right? You can have a family member, or you can have a space that you rent that has multiple rooms. You rent to multiple professionals, and there you go. You are able to offer multidisciplinary services in your area. You don't have to know it all. All you have to do is find other people that are willing to come and offer services in the center. Could someone argue that you're in the property space? Maybe you are, but your intention walking into it is to make sure that there's a multidisciplinary team that is there able to help you with your needs, because we all work so interdependently. But we will all sit and complain, oh, there are no OTs in my area, I'm not able to refer. Why can't you just rent the room next door and find an OT and offer them a service level agreement to say, come, let's work together. I'll be in this room, I have my own business, you'll be in that room, you'll have your own business, but let's refer to each other. In every community that I know, there's a primary school, meaning pediatric healthcare is needed. In every community that I know, there's a struggling clinic, meaning they need assistance with rehab. So it's a mindset, one, yes, and it's a skill set and enablement. But three, it's just a general ethos and identity that we've just carried so proudly in a weird way that we're not in this to make money. It's almost as if we declare that we are not going to participate in the economy of healthcare. We just want to do stuff for free.
But also I think it's because it stems from a very dichotomous thinking, where we don't realize that two opposing things can be true at the same time. We think that it's either or, and that's where the problem is. And I mean, I won't mention names, but I've heard of people in the speech and language therapy space who are very much like anti-private. And I ask myself, like, but you have to ask yourself, you think that you are all noble and holier than thou because you work in like primary health care or government, that you think you're providing like, community-based service, but where does that money come from? Nothing is free. Absolutely nothing is free.
Someone is paying for it.
Someone's pocket, right? So if you think that by wanting to generate wealth for yourself, that means you can't also want to help people. Some of the biggest like community projects or most philanthropic projects come from people who first had to generate wealth somehow, and they give back in some way. But I want to move away from that topic a little bit and go back to when you started your practice, and you said that you had so many bookings and you were getting really busy. Talk to me about that, because one of the biggest problems that people have when they start a practice is how do they start getting clients? So what were some of the key things that you did in the beginning to really generate that interest and have people know who you are and actually make bookings with you?
Yeah, and again, it will be another unpopular opinion, not the norm for most, but social media. Social media was the friend because I just had to stop and ask myself, what am I doing all day? I'm on my laptop attending Teams meetings, reading emails, and I'm on my phone getting broadcasts on WhatsApp, reading on Facebook about either load shedding or the new variant of COVID. Our phones and our laptops became the thing that we interacted with the most. And so to me, it was a no-brainer that if I'm going to start a business, the best way to reach a person is through their phone. And I think if you also just look across the pond with many other businesses or many other self-employed freelancing, independents in other sectors, there are people who have made millions on YouTube, on TikTok, on Instagram, and obviously they do different services and they offer different options, and their business model is different. But I think once you are open to learning from what works in other sectors, because at the end of the day, as healthcare professionals, we treat people across the lifespan. So it's not like you have one specific target market. Everyone is your customer. And so for me, I started with, okay, if I can't physically go hand out pamphlets because that's what the traditional thing is, or you can't buy a newspaper, how can I create a digital advert? What are most people doing and where are most people consuming their information from? And for me, WhatsApp was the first place where I started. And you'd be surprised how quickly word of mouth goes if you link, something that works. And it was also free, by the way. It was also by circumstance. I had to choose what kind of advertising can I afford. Social media is mostly free if you have access to Wi-Fi or data. And my first ad that I put out was on WhatsApp, and most of the people booked either because they knew me or because someone reshared. And this is something that happened organically. I think this is also another example of start where you are and with what you have, because you might think, I need to go buy or get Corex boards for the side of the road, but nobody was driving anyway. I remember back then, even driving out to go to the shops, the roads were so empty, and I thought, I can't hand out pamphlets, nobody will get them. So think about what are the circumstances, what are the factors that are existing in your community, where are people huddling the most? And at that time, people were huddling online. I remember the song with Master KG, Jerusalem. Even American celebrities were dancing to that challenge, which all of us were consuming online. And to me, it was a no-brainer. I was like, okay, I'm going to also post my stuff online. It's free, it's quick, it's easy, and it doesn't, it's not going to take anything away from me, and let me see if it works. So it was trial and error, but a lot of online marketing. And I think a lot of people use social media to make people aware about the profession, or to talk about diseases, or to talk about Healthcare Awareness Day. Did you know today's autism? And that's one way of doing it. But if you stop and you think about what is the action that I want my end user to do, I want them to book my service. So will telling them about autism make them book me? No, it will inform them about autism. It also comes from the mindset where you think your role is to teach. You think your role is to inform, and that is part of your role. But how can you merge the two of how can I inform you about something that can affect you and inspire you to take an action and book my service to do something about it? So it becomes a completely different strategy, which to this day I see healthcare professionals, a lot of their marketing is about teaching people about diseases and not enough about here's what you can do to prevent 1, 2, 3, right? And only now, as well-versed, maybe not as well-versed, but as a learning business practitioner who has to do marketing, I realize we do a lot of fear-mongering marketing. Do you know you're going to get cancer? And I'm like, okay, if you scare a person, they're just going to scroll past, It's not often that fear works to inspire someone to do something. The same way you can tell me I shouldn't eat chocolate, it's unhealthy. I'm still going to eat the chocolate. But if you say, do you want to learn how to decrease? So it's a different question, it's a different mindset, but it's also maybe another example of how we are using the traditional way of thinking and maybe some of our isms and our adopted identity as marketing. And sometimes that doesn't always work. And for me, I remember one of my most successful ads that I've run to this day was showing a video of how I clean ears. Something simple. It was both informative, but at the end of all my videos, whether it's 5 seconds, 10 seconds, or it's a picture, I would say, do you want to get your ears cleaned? So you are asking the end user the question, and they have to ask themselves. And if you're showing a good enough visual and you're showing what kind of a good service you're going to get, most people are going to say yes. Then the next hurdle is how easy is it to book you? Because a lot of the time as health professionals, we put a schedule that's convenient for us. I had to
Yes.
stop and think, people between 9 and 5 o'clock are also sitting on a computer doing their work online. So let me make it easier for them and say, do you knock off at 5:30, and would you like someone to come clean your ears at 6 o'clock when you get home? Because it says to the person, I'm thinking of you. I'm not telling you I'm available at this practice on Wednesday between 12 and 2. Already, you don't care what the end user wants. You don't care what time they're free, what their circumstances are like. So the barrier of entry into booking your service is you've used your schedule to structure your business.
Yeah.
The person you want to come in is the other person whose schedule you haven't considered, right? Then the other second big marketing thing that I did, and maybe the last example I'll share, was I thought about a mom with kids, because also that was my reality. I was a mom with kids, and I said, are you a mom with multiple kids that need to go to multiple appointments? Would you like one of the appointments to be at your house minus the commute and the car seat struggle? Because it's relating to something that if you're a parent watching this, you know how much of a hassle it is to get a child into a car seat, to get to an appointment, and then it's unfamiliar and then they cry. And just planting in their minds the idea of, imagine you could have a hearing screening assessment while your child naps at home. Because that is what I can do. But it took a complete rethinking. And granted, in COVID, we had a lot more time to think and be creative. So those are some of the things that I did to get people to book me. But I'm not going to lie, it wasn't 100 bookings in the first month. No, sometimes it was one booking a month. But what then carried me is the fact that I give good service and I empower my clients. Give me a review, give me your feedback, good or bad, so I can get better. Offer some sort of incentives within ethical rules, of course, to say, if I see one person in your family and there's two other people, I can see two other people for free, just to screen in case they have an issue. Entice your client to want to care about their healthcare or whatever your professional skill is. Because if you think about it, we are enticed every year. Do you want to upgrade your phone? Do you want to upgrade your car? It's not like we automatically wake up and think, oh, I need a new phone. There's been a lot of information that made you get to that decision. And so too with healthcare, and at least with my marketing, especially for something that's not normal. I do a lot of consumer education, and I do a lot of end user thinking about what will relate, what is happening right now that a lot of people will relate to, that will make them, first of all, watch my video for 15 seconds, because the average time is 0.3 seconds, then they scroll. So a lot of our with a lot of words and medical jargon, they scroll. They're not going to read that. So it's thinking outside the box. And I think as a business practitioner who's at a startup level, we can all identify with trying to think out the box and wanting to get clients to get into your proverbial doors and to get business in.
Yeah. So, I mean, some of the key things that you mentioned is really what I often talk about when I do presentations or webinars on marketing, is that people think of marketing as just advertising, so as just posting. And oftentimes people who are like, averse to kind of marketing will say, no, but like I get most of my referrals from word of mouth. And oftentimes it's people who have been around a while. And that's fine because you've been around a while, so you've built up a network. But word of mouth can't happen if there isn't one person to start off the process.
Yes.
Like if nobody talks about you, it's because nobody knows about you. So for a newer practice who's just entering the space, you can't just rely on word of mouth, because how do you create that network of a community to actually spread the word? And so like your example was, and then the other thing that I always mention is that everybody always wants to go the regular route of getting referrals by going to to doctors, for example. But sometimes your referral source comes from outside of the medical community. So if you are working with adolescents, for example, why don't you go to the church youth group? Why don't you go to the pastors, the lay counselors? Those are the people who are working with your target group. Then the other thing is that marketing isn't just about advertising. It's also about your brand, which is represents how you make people feel, what they experience with you. And the booking process, I'm glad you brought that up, because this is such an overlooked issue. I had a client who I who wanted to. She was mentioning that she needed to make an appointment with a psychologist like urgently because she was experiencing panic attacks, and she went to a bunch of different websites, and all of them have a contact form. So she filled in the contact form, and she's now solved the problem, moved on. We had some other discussions around. She was telling me about this, and she's like, you know what? Not a single one of them has come back to me yet. And it's not that
Yeah.
they weren't interested. Probably what's happened is because they wanted that fancy website, because that's what you do when you must market. And they have a contact form, and that contact form emails probably hasn't been set up correctly, or it's going to
Yeah.
some mailbox
Yeah.
into the spam. Whatever the reason is, they
Yeah.
probably didn't even see her like contact. And
Yeah.
now it's too late.
Yeah.
She's found a different
Yeah.
solution.
Yeah.
Or on the flip side, it could have been worse, that she really desperately needed someone, and because nobody
Yeah.
was able to get back to her,
In
something
time.
bad could have
Yeah.
happened. So
Yeah.
the experience of, and it doesn't mean that you have to now, go bend over back if it doesn't fit in your lifestyle to be able to provide the aftercare, like you're saying. But it's also
Yeah.
just, how easy is it for someone to make an appointment with you?
Yes.
Like,
Yes.
do they have to
I
jump through hoops and everything just to even get to ask you a question about your
I'll tell you,
services?
I experienced that as a new mom.
Mm,
The first 6 weeks, in fact, the first 12 weeks of me trying to book appointments for my daughter, to me, just made me more angry and anxious than anything. Because first of all, you want to ask, is there parking in front of the gate? Do I need to get a new COVID test? I mean, obviously it was back then. But then all of these circumstances that I was experiencing is the first thing that I thought of was, what would I not like to do? And I can tell you to this day, I hate phone calls. Maybe that's just a me thing. If I have to be on the phone to explain to someone why I need an appointment, and we take 5 minutes, I'm spelling my name, you writing it wrong, and then my medical aid number. To me, I thought, whatever the booking system is, it's primarily not going to involve phone calls. Because if I think about the amount of things I say no to, also because at that time our phones were bombarded, everybody was calling, would you like? So I was like, okay, we're not going to do phone calls, right? I want something that's easy that you can click. And you'll remember I said I thought about how easy it is to click on, I'll give an example, a Checkers app, order. You don't have to speak to anyone. You don't have to engage with, you don't have to explain to anyone why you're buying 10 chocolates. You just order it and it's at your door, right? And to
yeah.
me, I thought, how could I do that? And when I came in with that curiosity, I found that there's so many free online booking sites that you can use where you can preset. In fact, that's why I didn't have a website for the first 6 months. I used a free booking online system. You say, these are my services. So you think about, if I am the end user, if I click on this, am I able to navigate and say, what kind of assessment do I need? Or have I put the assessments in medical jargon? Right. Also,
Absolutely.
if you, for example, are going to buy a website with a contact form, it's not immediate. There's nothing wrong with that. The current currency in our life of the digital ages, you want to know that the appointment is booked, that someone expects you, you need to know what's expected out of you. So the immediacy of it is the bit that you take out. And that also requires human resources. And I didn't have an administrator that can check my emails and check my booking forms. And I didn't have money to even get a website. So I had to think. And I'll tell you, I discovered booking links on other people's Instagram pages. And I'll be very frank, makeup artists, hairstylists, nail techs, they figured this out a long time ago. Create a link, book a hairstylist to come to your house, because that's also what we did in COVID. You didn't go to the salon. You booked someone that said, here's my COVID test, and book me. And I thought about, again, it's going to seem like I'm advertising WhatsApp, but it's just one example to think about. How many things do I get accomplished on WhatsApp? From work meetings to work. It's not, imagine you had a link to a WhatsApp and you can speak to an OT to say, hey, my child has this. Do I need an appointment or not? And in the beginning, when you don't have a large influx of clients, sometimes what you need is a WhatsApp link on your social media for people to ask questions. And think about the efficacy of what you're doing. It comes with the website, but if someone has to email you, you have to respond, and then you have to then figure out a timeline and a schedule. Imagine they could log on and see your schedule. Imagine they could just read what services you offer, for how much, what medical aids you offer. So that's how I thought about it. I thought, I want my end user to click and I'm at their door. That was honestly the strategy that I followed with any and every linking or booking system that I tried, if it forced them to pay or it forced them to do anything before they come, I wouldn't use it because like it's going to be a barrier. I want it to be as simple as possible for me to be able to receive your booking and come to your house with as little time as possible, because these days you are fighting with people who want to know, can you see my daughter today or not? And that's also, with time, I learned to now start charging a rush fee, because some people just want to be seen now, and you think, oh, this is a problem. But to me as a business person, that's an opportunity. You say, I'm more than happy to reschedule my day if you're willing to pay a rush fee, because I stole this from the plumbing profession. I had a geyser burst. They have a call-out fee. You pay 750 Rand for a plumber to come to your house. They have a rush fee. They haven't even charged you your service fee. And again, we'll start another conversation another day about billing. But with time, you learn this thing. Start with the lowest hanging fruit. Look at how you communicate with other community members in your region. That's where you should advertise. That's how you should advertise. That's what should be your booking system. If, like you were saying, the community leader at church can't refer and book a client to you when you mainly dealing with adolescents, your booking system is wrong for your target group.
Absolutely. Yeah. So I want to move on to now, as we've reached the tail end of this discussion, is to talk about your business, which is the healthcare professional development and business consulting business, right? So tell me a little bit about that. How did that come about, and what do you mainly do through that platform?
So my other business, Hlayisi Healthcare Professional Development or Continuous Professional Development, you'll remember I said when I started, that's what I did, right? I started and I did my master's research and my postgraduate education quite early on in my career. So oftentimes I'd have colleagues ask me, oh, how do I write a research proposal? Oh, how do I do this? How do I do that? And I just used to do it until someone, a statistician, in fact, that I'd met who was doing biostats and helped me with some of my stuff. He's like, I charge for every time someone asks me, how do I do this? I do it for them, and then I charge that, and then I show them how to, and then I charge for that. So sometimes it's just one of those businesses that came to me because people were already asking me to do things. And sometimes that's where your most natural and authentic business is. What do most people ask you for? Whether it's your clients, fellow professionals, family members, what is the one question you're answering the most? Because that means that's your skill set. You're either coaching, mentoring, consulting, and you're helping someone. Whether it's how do you bake a cake? How do you make ginger cookies? Or how do I make therapy assessments? Oh, where did you download that from? That's something that you figured out, that someone else has noted that you have figured out, right? And so you can start building around that. And again, start with one person. If you help one person really good, the next person that asks them, oh, where did you get that? Is, oh, Tasneem help me. And that's how you build it. So that's how Hlayisi Healthcare Professional Consulting started. And with time, as I got into academia, I started to do research consulting. And now that I'm in business, I do quite a bit of business consulting, because unfortunately, there's a lot of young people that are unemployed, and even seasoned practitioners that have reached a ceiling in terms of how to expand the business. How do I engage the current target market? There's younger people now. How do I use technology? Or how do I do what you did and have a completely mobile arm that offers those services to people who do not want to leave their houses, after they come back from work? And so I just sort of turned the thing that I was doing anyway on my WhatsApp, and people were asking me stuff, I just started charging for it. And in the beginning, it was hard because some people were also issues. I'm like, yeah, because I went and I figured this whole thing out. And yes, I'm going to tell you because you're a colleague, but I'm also going to charge you because this is now, I'm going to spend an hour of my time customizing my answer to your specific problem. And you know what? That's an economy in and of itself. It's called business coaching. I happen to do it in audiology. And so that's how it started. And I think my big passion project with it now is to help upskill health practitioners, and I don't know a lot, but to help upskill health professionals on how to monetize your skills. And very parallel to Private Practice Growth Club, but to say, what are the rules? What are the skills? How do you put that together to offer an evidence-based solution providing intervention for your community that can make you either some side hustle income or can become your main income. And I can only share from my experience. I don't declare myself as an expert, but I will charge you for my time because I have spent 10 plus years figuring out some of the things, and you're going to get it fully wrapped. So that's how it started. And I mean, it's obviously has grown, and I'm now engaging with bigger organizations that want to work with audiology as a sector, because audiology is now expanding. There's now franchise models similar to optometry that are coming up. There's now different credit systems that are linking in terms of the business side. How do you provide a credit solution for clients that don't have medical aid? There's the billing aspect. There's so many things that are happening in the profession that I think 10 years ago I didn't know about, because I didn't even want to open the window to look, oh, what's there? Because I knew I'm just supposed to test hearing. I'm supposed to help people with hearing aids. That's my job. But when you look behind that, there's a lot of stuff. For example, a lot of biotech companies are looking to create therapy resources, right? They have the money, they have the know-how, and they have the intention, but they need rehab professionals to inform them what is needed in the market.
Yes.
How could technology help us? And that in and of itself could be research consulting, could be clinical consulting. However, we end up finding a term for it. That's essentially how Hlayisi healthcare professional development was started.
Amazing. Well, thank you so much, Vera, for sharing all your insights. And obviously, I will put the links to the consulting company so that if anybody wants to reach out to you to access your wealth of knowledge, or I don't know if you have like workshops and stuff as well, or is it mainly like on a needs basis?
Yeah, so we do have private sessions where people will say, look, this is what I need. And obviously I can tailor whatever consulting service based on the need. But last year I started also doing sort of a workshop kind of format where I have 10 to 15 people. I don't like it to be too big because I feel like you lose the intimacy. And I feel like, in fact, after you pass 8 people are not honestly engaging and asking questions openly. Everybody just wants to, present a particular facade. And so I try and do workshops. And last year I did a beginner one of how do you start a business? How do you start a private practice? Never mind a mobile one. What are the steps? And you'd be surprised that information is openly available, but putting it together for a profession specific thing to say, oh, what kind of business do you register as? What does that mean for tax? How do you pay yourself? It's just, you can do courses from here to the end of the moon, focusing on audiology. What are the income streams? How do you bill? How do you charge? There's so many. I didn't even get there, but I started with how do you start? Where do you start? Because another passion project of mine from my research side of things is really trying to tackle healthcare professional unemployment, because I think it's absolutely ludicrous that we are sitting and waiting for someone to employ us when we can see a lot more of us are unable to secure employment. So I'm really quite curious and keen to work on how can we provide solutions. And I think that's how my latest company was born, Caesar Hearing Solutions, to try and create testing equipment place where you can get something that is not as high in terms of capital investment for you to start somewhere, So for audiologists, we do offer that to say, look, if you want to start or even expand your practice, this is where you could start. Because I too fell into the trap of buying, equipment, which is very expensive, and I was trying to pay it off with the salary and this and that and it's in COVID, and the barriers of entry into the business side of things is quite high. And I have to state that maybe in the tail end to say, we speak so well of business and we are encouraging people, but we must also be responsible to tell you that it is a tough thing and it is expensive. And that's why some of these businesses have popped up, like consulting, where you can ask someone, how did you do it? What are the pitfalls? Or you have other businesses that say, look, here's that can offer you equipment on a credit line if you already have a business and your business can afford it. Obviously, it's not exactly a start, but we're starting somewhere. You have to start somewhere.
Yeah, absolutely. Well, thank you so much for your time. I think you shared so many golden nuggets that I think a lot of people will get value from. And as I said, all the links to all your different platforms and information will be in the description box below the video. But thank you so much.
Thank you so much, Tazim. And I think I must say thank you for being the person that started private practice grow club, because we're not starting from scratch. Certainly I didn't start from scratch, because some of the things are not new, they're not unique to audiology. Someone just has to say, what is out there, how do I customize this to audiology? So I think you're one of the people that have spearheaded this. That is a newer passion for some of us, but you've been doing this for years. So thank you to you. We see you and we appreciate you. Even though we're not OTs, we see you and we appreciate you for the work that you do.
Well, that's the thing. It's like in every, and that's the thing. I speak about this a lot. It's like my soapbox thing that I always get on about, is that, like, I think competition is healthy for you to up-level your own game. It's not a thing that is meant to be against the other person, And so, like, I could say, well, Instop is also doing similar to me. They are my competition, and I share this stuff all the time. Like, just now, Pumla Motsa was actually in my academy, has now done her own thing with somebody, and I'm happily sharing her stuff all over the place. And we share only success, and that it grows, because to me, it's like, we all learn from each other, and I might not be somebody's person, but they still need that help. And Pumla is the person, and so I'm going to direct him, and I'm still going to be helping somebody. And I always believe, you give out, you get tenfold in return. And I'm kind of, I because I'm not focusing on a specific area. I might be an OT, but I'm not specifically focusing on OT. That's what Instop does. You focus on audiology. Somebody else might focus on physio. That's fine. So you get your specific niches, and I kind of feel like I fall in that overall, bringing everyone together, these resources together, so that we all share in this health economy that you spoke about, which we want to grow in a way that still impacts the world in a positive way, while still being sustainable for the individuals who are providing these services. And that's really my greatest vision of growing the health. So, well, thank you so much.
Thank you for your
all your projects going forward. Bye-bye.
Thank you so much. Bye.